The Maria Holder Diabetes Center.
Eye exams, kidney checks, foot exams, these are all part of whole person diabetes care.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
Get ready, Q family! Are you ready?
I'm ready!
It is time for another 15 diabetic friendly minutes on 100.7 QFM to enlighten and educate you, all with the compliments of the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and First Citizens Bank. They put you first. It's Peter Boyce here. How are you, Q people? How did you all enjoy your Easter weekend? Did you go to Oysters Fish Festival? And then you have Q in the community tomorrow too. Cheese, dawn bread. So many opportunities for you to go out and enjoy yourself. But I hope you're still remembering to look after yourself too. Especially if you are diabetic or pre-diabetic by visiting the Maria Holder Diabetes Center.
That's located where again?
In Warren St. Michael.
Oh, that's when you pass Smart behind Uniscapes Polyclinic?
Exactly.
I know what that is.
And one of the important things that you can do for your health when you get there is to get your eye screened for diabetic retinopathy. If you are diabetic, do you know how often you should do that?
Once a year?
That's right, once a year. Not once every other year or when you feel like it, every single year. But in case you are wondering what might happen to you if you don't do that, Q family, whatever you are doing, stop doing it now and listen to what this lady here says happened to her.
At first, my eyes were just a little blurry. I ignored it, figured it would clear up on its own. I wore my glasses and went on with my day. It seemed fine, but the blurriness stuck around for months, and still I didn't pay any mind. Then one morning, I saw floaters. Tiny dark spots drifting across my vision. I told myself it was just because I hadn't been sleeping well. Deep down, I knew I should have gotten my eyes checked, but I didn't. Eventually, it got worse. The blur turned into darkness, and that's when I got scared because I knew my vision was failing. Don't ignore your vision. Make sure to get your eyes screened early as a diabetic. It could save your sight.
I hope you hear that, Q family. So make sure and get your eyes screened here. Just call
243-3937.
Another thing that you can get done at the Maria Holder Diabetes Center is a vascular screening. And you might be listening to QFM right now and you might be saying,
as a man, why should I get a vascular screening, though?
Let's hear what spokesman Donald Clark has to say about a vascular screening.
I should indicate that this is not a male-only condition because of erectile dysfunction, but female condition as well. Ladies with varicose veins has their condition to have this ailment. So I would want to say that women should also have this test done. Again, peripheral artery and peripheral vascular, which is different because arteries are arteries and veins are veins. But varicose veins is a telltale sign that there's a problem with peripheral vascular disease. In men, of course, it's erectile dysfunction. That is major. That's how you tell that there's a problem. That's how men would normally tell that there's something going on. There's no blood flow, or there's, I should say, a reduced blood flow to the penis, of course. But in women, varicose veins is a telltale sign that there's also a problem. Peripheral artery disease, it's a simple test. It's called an ABI test, and I can't stress enough the importance of getting this test done. Once you have reached 50, you need to go and get that check done. It's peripheral artery disease. It's a simple test. It's called an ABI test. What they're looking for is to see the blood flow in your lower extremities. And I can't stress enough the importance of getting this test done. I'm glad to know that the Maria Holder Foundation is offering this. Individuals need to go and get that test done. It's a simple test. It's all external. Again, it's like taking your blood pressure on your lower extremities.
Simple so Q family, if you feel you might have bad circulation, you should get a vascular screening. So now it's time for Dr. Diane Brathwaite coming back to do diabetic nerve disease part 2. You remember she did part 1 last week? Well, this is part 2. So Dr. D, what is the most important thing about diabetic nerve disease?
The most important thing, however, is if you have a problem, you get it checked early, okay? And remembering that some of the risk for it or the likelihood of it can increase if you've had diabetes for a longer period of time, but especially if the blood sugars are consistently high or you find that you're having large fluctuations in the blood sugar. Other factors for nerve injury, if you're living with diabetes, are going to be uncontrolled high blood pressure, high levels of fat in the blood, smoking, and alcohol use in particular, which also targets the nerves. So the management really is controlling the blood sugar as well as possible. And then if you're having pain or other symptoms, there are some medications that can be used to relieve some of the symptoms of the diabetic neuropathy. So, and of course, I haven't said there are other non-traditional practices that can be used to help neuropathy, such as massage and other alternative practices. However, my biggest recommendation is that if you have a problem, especially if you're living with diabetes, make sure that you have a proper medical check before you go out doing your own kind of remedies on the foot, because sometimes some of the things people put on their skin or things that they may do to their feet can actually cause more harm than good. Okay, so remember, although we are here to give you information, we are more about pushing prevention, and we want to make sure that we encourage people to check their feet every single day. If you cannot see your feet or the skin down there or between the toes, have somebody look at it for you, because if you have neuropathy and you have a minor problem, for example, just a rub from a shoe or something else, you might not feel it, and by the time you notice it, it may have turned into an ulcer or an infection or something like that. So let's take care of our feet. We see too many feet issues, and we want people to save their feet and to have the best possible quality of life that they can. Always wear proper fitting shoes. Just remember to take care of yourself. So thank you, and I want to encourage everybody, regardless as to where your diabetes is, whether you're type 1 or type 2, a good lifestyle can help you have great control. And if you're living with type 2 diabetes, a good lifestyle and consistency and discipline can help you not only have good control, but it can also possibly help you reduce the amount of medication that you're taking. But remember, at the end of the day, the main thing is every person with diabetes is different, and you need to maintain control whatever combination of lifestyle and or medication you require to do so.
Thank you, Dr. Diane Brathwaite, for giving us that healthy lifestyle information to help the Q family enjoy their lives as we go into our Q song of the day. And this is Mikey Mercer getting you ready for crop over with Enjoy My Life. Compliments the Maria Holder Diabetes Center and First Citizens Bank.
Here we go! We're balling for the whole day, jumping up on the highway, having fun while we're young. Let me enjoy it, let me enjoy it. Drinking till I get tipsy, winding up like a gypsy, having fun while we're young, 'cause this is how I enjoy my life.
Maria Holder Diabetes Center.
My life. This is how I enjoy my life. My life, my life. This is how I enjoy it. The atmosphere is crazy, the atmosphere is hype. So drunk I can't see clearly, but nothing can spoil me night. Don't try to stop me, I'm going death first tight. Don't tell me to take it easy.
lifestyle and consistency and discipline can help you.
Now welcome a patient of the Maria Holder Diabetes Center, Mr. Paul Edwards. How long have you had diabetes and what challenges have you encountered with the condition?
I had diabetes since 2009, and it wasn't when I was working permanently in Barbados. It was when I was working in Grand Prix motor racing, where my driver saw me a little bit woozy when I got off of the plane, and he was a diabetic himself, and he tested me, and I was 22.
Wow.
Blood count. So I was well over. So from that moment onwards, I knew I had a problem. I've been a patient of Maria Holder Diabetic Center for probably about 7 years now, since I've lived permanently in Barbados. And I've worked as a chef and in several restaurants in Barbados. But to be fair, I've known Miss Brathwaite, Diane, I've been under her care for this period. And I must tell you that she's been extremely helpful to me and probably saved my toes at least 3 or 4 times in the last few years. From my point of view, I've referred, and Diane has met many of my, probably 2 or 3 colleagues that have diabetes, and they've also become firm patients of the Maria Holder Center.
In terms of you personally, how did diabetes impact your lifestyle?
Tremendously. When I first discovered in 2009, when I told you that, the first situation for me was having a reading of 22, I was referred to a doctor in Melbourne in Australia, and when I came back to Barbados, which is my place of residence, I immediately contacted Dr. Brown, who referred me to the Diabetic Center, to Diane, obviously just straight away. It impacted me in the way of, I was suffering with my feet terribly, high blood pressure always, not listening to Diane Brathwaite always, because she calls me her bad boy, because she just wonders how I survive. But to cut a long story short, I couldn't have done without them. Even when, the going was tough, Diane helped us with some, medicines and made sure that we all got, what we needed to keep going and, to control our diabetes. This facility is top notch. But the long and short of it is, Barbados for many, many years has been known, and sadly, I'm sure that this reputation is getting a lot better. It's always been known as the amputation capital of the world, which is really sad. But with the help of everybody that works at the Diabetic Center, I think we've kind of moved a little bit forward from that now, because you can get help, and I would advise anybody in Barbados who just thinks they may be a diabetic to go to the Diabetic Center. I have nothing but high praise for it.
If you are diabetic or pre-diabetic and listening to QFM right now, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and First Citizens Bank.
Together, we can turn your dreams into reality, whether it's owning your first home, driving the car you've always dreamed of, or a little extra cash for life's special moments. We're here for you. At First Citizens Bank, we'll work alongside you to create a loan that's as unique as your goals. Let's take that first step together. Visit firstcitizensgroup.com or your nearest branch to find out more. First Citizens, we put you first.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
Sugary drinks spike your blood sugar faster than anything else. Water is your best friend.
The Maria Holder Diabetes Center.